Hi, everyone, and welcome to our webinar. Today, we'll be talking about planning for end-of-life care in conjunction with Voice Your Choice, Montgomery County. Today's webinar is entitled Voice Your Choice, Information and Resources for Advanced Care Planning. Today, we'll be hosting this webinar in conjunction with the Archdiocese of Washington and Voice Your Choice, Montgomery County. So just by way of introduction, my name is Catherine Windles. I'm the Director of Life Issues for the Archdiocese of Washington. Today, I'll be discussing some of the Catholic moral teachings around end-of-life issues and advanced care planning. Also here from the Archdiocese of Washington is Mary O'Mara, who is the Executive Director of the Department of Special Needs, and Mary will be talking about ways that we can adapt advanced care planning for persons with disabilities. And today we're especially excited to be hosting this webinar with Voice Your Choice Montgomery County. So thank you so much to Val Walker, who is an advanced care planning trainer with Voice Your Choice. Voice Your Choice is a program of Nexus Montgomery, and that is a community-based program led by the Jewish Social Services Agency that promotes advanced care planning through training, education, and public awareness. The purpose of this webinar is threefold. So firstly, we're going to be sharing some information about Catholic teaching on end-of-life issues. And we're going to be focusing in particular on hospice care and palliative care. We'll also be discussing the 5 wishes and ways that we can adapt a living will for persons with special needs. And finally, of course, we'll be sharing some information about community resources for advanced care planning, including, and especially during this time of COVID, the Voice Your Choice online advanced care planning program. An advanced care plan is sometimes known as an advance directive or a living will. And an advanced care plan is any type of written statement that details your desires for medical treatment and decision-making in circumstances in which you personally are no longer able to express informed consent. I think there's a stereotype out there that advanced care planning is primarily for sick and elderly members of our community, but it's really important for all of us to understand that advanced care planning can actually help each one of us, regardless of age or stage of life, to prepare for unexpected situations. In reality, creating any kind of advanced directive is just a great way to voice your choice amid uncertainty. And in uncertain times, this is even more essential. So why plan in advance? I think it's true that many of us would rather avoid thinking about illness and thinking about death. But the reality is that end-of-life issues are the only issues that are guaranteed to impact every single one of our lives. It's very important that we create an advanced care plan, not only for our own well-being and to ensure that our own needs are met, but also to help alleviate some of the stress and pressure that might come to our friends and family members. So in the event of a serious illness, it's very important that we provide that sense of comfort to ourselves and to the people around us who might have some burden from making some of the difficult end-of-life decisions. Finally, an advanced care plan is not just about limiting options. And in fact, it's not talking about what you don't want. Instead, an advanced care plan is a great opportunity to talk about what kind of care you do want in your end-of-life stage. An advanced care plan is fundamentally about empowerment for each and every human person. Each state Catholic conference generally publishes some kind of guide for end-of-life issues and advanced care planning. For the state of Maryland and for the Maryland Catholic Conference, this document is called Comfort and Consolation, Questions to Consider Now and at the Hour of Our Death. So the MCC actually just revised this document. It's now a tremendous resource, and they've done a lot of work on making it very readable and palatable for every person. I really encourage you to take a look at the PDF, which we've included. I think you can see it on the right side of your screen. Comfort and Consolation is a great name for this document because it talks about the Catholic priorities that we have for the sick and dying. So while Catholic moral theology prohibits treatment that's intended to bring about the death of any human person, that doesn't mean that Catholics don't have important decisions to make at the end of our lives. Every single one of us is called to a process of discernment. to think about what kind of treatment we would choose for ourselves. And we're also called to share this information with people around us, and especially those who are closest to us. Comfort and Consolation outlines 8 principles for end-of-life care, which we've shared here today. The first principle is that we do not have the right to take our own lives, nor to directly bring about the death of any person. And this is because each one of us is obliged to care for the gift of life and to care for the health that God has given us. No patient is obliged to accept or to demand useless or excessively burdensome medical interventions. And each human person always has dignity, even in suffering. Even when we cannot cure, we can always care. This Catholic teaching is particularly important. There is a presumption of providing food and fluid unless it is futile or death is imminent. Patients in end-stage conditions or persistent vegetative state possess dignity and deserve good care. And finally, preparation for death can be a beautiful time to reconcile with family, friends, and God. Each of these principles, and in fact, all of our Catholic moral theology and Catholic social teaching, is really based in this emphasis on the life and dignity of the human person. This is one of the most valuable teachings we have as Catholics, and it informs all of our moral teaching, especially on end-of-life issues. The Catholic Church proclaims that the human life is sacred and that the dignity of the human person is the foundation of a moral vision of society. This belief is the foundation of all principles of social teaching. We understand that in our society, human life is under direct attack from abortion, euthanasia, and physician-assisted suicide. So a lot of our advocacy and public policy work is really built around fighting the commodification of the human person. So a lot of our advocacy efforts are rooted in opposing abortion, euthanasia, and physician-assisted suicide. These are all very important topics for us as Catholics. And in fact, if you're interested in learning more about our advocacy efforts at the Archdiocese of Washington, please don't hesitate to reach out to myself or to Mary O'Mara, and we'd be very excited to share some resources with you and talk through some of our advocacy efforts in conjunction with the Maryland Catholic Conference. Within the context of end-of-life care, we really express our dedication to the dignity of the human person by prioritizing hospice and palliative care. Catholic moral theology upholds palliative care and hospice care because we do believe that each person deserves dignity, especially in their final hours. So the Catholic Church really does support the use of pain-managing medications and treatments, provided that these treatments are used with the intention of comforting a patient and never with the intention of causing harm. Just to establish some of the terms that we'll be using throughout this presentation, palliative care is a specialized medical care for people who are living with a serious illness. So this type of care is going to be focused on providing relief from symptoms and stress. And the goal is to provide quality of life for both the patient and the family. So palliative care is provided by a specially trained team of doctors, nurses, and other specialists who might work together with the patient's other doctors, those other doctors providing curative care, in order to provide an extra layer of support. And this means that palliative care is based on the needs of the patient and not on the patient's prognosis. It's going to be appropriate at any age and any stage in a serious illness, and it can be provided along with curative treatment. This is slightly different from hospice care. So hospice care provides treatment for people in the final stages of an illness. And hospice care in particular allows patients to live out their life fully and to experience a peaceful death. And hospice care generally comes after curative care has been completed. Palliative care has been shown to have a number of benefits, and we really do promote this in the Catholic Church. All Catholics are encouraged to seek out palliative care to ensure that they're comfortable at the end of life and that they're able to enjoy their final hours very fully with the presence of their family. And early palliative care has actually been shown to improve quality of life, to decrease depressive symptoms, and of course, to even help patients live longer. So numerous studies have actually shown that patients who receive early palliative care report a greater sense of peace. They report improved mental health outcomes and do tend to live longer and more fulfilling lives, especially in their final days. Hospice and palliative care both offer people and their families the opportunity to enjoy these final moments. And Catholics are never encouraged for the use of these medical services. In fact, all Catholics are encouraged to seek out medical care that brings them comfort and consolation, especially at the end of life. The USCCB has a great document called To Live Each Day with Dignity that outlines some of the Catholic teachings on end-of-life care. So if you're interested in learning more about this topic, I encourage you to read this document fully and to take a look at some of the values that are shown there. This quote, I think, does a really great job of summarizing some of these teachings. Respect for life does not demand that we attempt to prolong life by using medical treatments that are ineffective or unduly burdensome. At the same time, intentionally hastening death, whether through drugs or deliberate neglect, offends our God-given dignity and is never morally permissible. I think this quote really highlights the foundation of Catholic teaching on end-of-life care, because Catholics are always encouraged to use the virtue of prudence when making any type of moral decision. The virtue of prudence encourages us in all situations to seek out the most good and to avoid evil. So in making our end-of-life decisions, Catholics are encouraged to pursue palliative care if they so choose, to do whatever ensures comfort at the end of their life, but also to always act in a way that upholds the dignity of the human person. This means that there are many, many options for end-of-life care, even and especially for Catholics, as we seek to uphold both of these foundational principles, that we are fundamentally dignified and deserving of comfort and care, and also dignified and deserving of following these Catholic moral teachings at the end of our lives as well. Finally, in making some of these decisions, you're going to want to choose an advocate, so someone who might be able to speak for you if you're unable to speak for yourself. So one of the essential components of an advanced care plan is choosing a healthcare agent. And you might want to find a close family member or a friend who you trust. And in particular, this person should be someone who you've spoken with pretty extensively about your own healthcare and about your own wishes for end-of-life care. You might also consider identifying a secondary agent, so someone who might be able to stand in if your primary healthcare agent is somehow unavailable. And it's really key here that this person is someone who knows you and understands both your personal and religious values. So this agent should be someone who's patient, someone who's willing to accept input from other family members, and also from religious leaders, without being swayed by some of the pressures of a very stressful situation. So in choosing your end-of-life care, we really do encourage you to take some time and discern these issues, to read fully about Catholic moral teaching, but also to think really deeply about your own desires and how you can connect with family members and religious leaders to discern some of these really complex questions. If you are looking for more resources, we'll share some throughout this presentation, but we also encourage you to reach out to the Office of Life Issues if you would like to learn more about Catholic moral teaching on advanced care planning and end-of-life issues. At this point, I'm going to hand over the presentation to my colleague, Mary O'Mara, and Mary will be talking a little bit about the many ways that we can adapt advanced care planning for persons with special needs.
Thank you so much, Catherine. Thank you for really kind of framing our time here together this morning, and for also speaking to how important it is that we empower each person. So what I would like to talk with you a little bit about, and just kind of touch on the surface of how we can include and embrace and empower persons who also are living with developmental disabilities in their own input to what their decisions might be in end-of-life decisions. Just before we get into that, just a couple of housekeeping things that I wanted to bring to your attention. There are 4 handouts that are in the control panel it should be to the right of your screen. You should have a control panel there. You will find 4 PDF handouts, one of which is a copy of the slides from this presentation. So please feel free to download those handouts. Additionally, on your control panel, you will see a questions section. You are all most welcome to ask any questions that you would like during our presentation today. Just leave the questions in the question box, and at the end of our content presentation today, and after Val speaks about Voice Your Choice, we're going to have time to go back and have a look at some of those questions. So we will have Q&A at the end. So please feel free to place your questions in the question section on your control panel. Thanks. So Catherine had spoken about empowering each person. So I'd like for you to meet Frances. Frances Dwyer is a dear friend of our department, and we want to recognize that in any case and in any situation and with any individual, that discussing death and end-of-life issues is never easy. But what did Jesus have to say about that, about the journey home? So here we read, "Do not let your hearts be troubled. Believe in God, believe also in me. In my Father's house there are many dwelling places. If it were not so, I would not have told you. For I go to prepare a place for you. If I go and prepare a place for you, I will come again and receive you to myself, that where I am, there you may be also." So in just looking at this picture, which pictures often can say 1,000 words, the joy on Frances's face is very, very clear here at the Youth Rally for Life. Frances is a parishioner at St. John Neumann in Gaithersburg, Maryland, and his faith and the faith of his family can really inspire all of us. And in knowing that persons with developmental disabilities have thoughts and ideas and preferences and likes and dislikes, just like all the rest of us do as well, and including them in these very difficult end-of-life decisions is extremely important to remember. People that we support are aging too. So in looking at some of the statistics, in 1983, the average lifespan of a person living with Down syndrome was 10 years. In 2007, it was 47 years. And according to the NDS, the current life expectancy is 60 years, and it is still rising. People with developmental differences will face the same age-related health cares, high blood pressure, diabetes, joint pain, cancer, and the needs are unique for their disability. It's very important too to recognize that persons living with Down syndrome have a very high expectation of developing dementia in later years. It is proportionately a very high percentage of persons living with Down syndrome. So this means that we need to think more about all of the issues surrounding aging, including end-of-life care, and when and how it is important to have those conversations with those that we love. We see and understand the emphasis for people with developmental differences to have choice over healthcare decisions and self-autonomy. In even our most recent past, people with developmental differences were forced to undergo procedures and denied treatment. And that reality cannot be ignored. However, we know that making choices is not done in isolation. Pictured here is one planning tool known as the Life Course tools developed by the Community of Practice. There are many different aspects of persons within this circle of support for persons with disabilities. So we make choices every day, but even the smallest choices impact all of us all those around us. And the same is true for persons living with developmental disabilities. We are not an island. Our decisions influence and impact many of those around us. Self-determination and self-autonomy give people with developmental differences control over their lives, but it doesn't mean that decisions are made without a circle of support. So we know that it is imperative that we include persons with developmental disabilities in these very, very important end-of-life decisions, and surrounding them with that circle of care and circle of support ensures that they are making these decisions with their own likes and dislikes honored and recognized and acted upon, but within the support circle that is going to provide all of the necessary network of supports in medical and family and social circles of the person living with a developmental disability. Maryland Healthcare Decision Act outlines who can be a surrogate decision maker for a person if the person needs help to make decisions, including end-of-life care and other complex treatments. We also seek guidance and help ourselves when we have complex decisions to make. Not always believed by hospitals, doctors, healthcare professionals, legal guardianship is not needed to help people with developmental differences in their healthcare decisions. Adult persons living with developmental disabilities can make these life decisions with the support of those in their circle of care. There are many, many resources and tools for persons living with developmental disabilities that empower them to be the central decision maker in their own end-of-life decisions. There are many factors about who can and who cannot be a surrogate decision maker. We are not going to, in this webinar, go into all of the details about surrogate decision makers. If you would like additional information in this very specific area, we welcome you to contact the Department of Special Needs Ministries, and we can walk you through all of the information and all of the resources locally in the state of Maryland that will aid you in navigating where all of those resources are. Here's one of several examples of an adapted tool that can walk through and talk through life decisions for a person with developmental disabilities. So this one is called Adapted 5 Wishes, and it embraces all of the different ways that a person might have their strengths in communicating, whether that is verbally or non-verbally, pictorially, iconically, in gestures. There are many different ways that persons with developmental disabilities can share their wishes and their likes and their dislikes in these very difficult end-of-life decisions. Knowing how and when to begin the conversation is imperative. As we discussed just a little earlier, persons living with Down syndrome have a very high percentage of developing Alzheimer's or dementia in their later years. Having these conversations early on, even if these are conversations that are revisited several times, is an optimal way to guarantee that your information that you are sharing with your loved one and receiving from your loved one is from a place that they are comfortable and feeling safe and secure and happy to share those wishes. Choosing resources and supports that are clear and accessible to a person living with intellectual and developmental disabilities. And as we just mentioned, some of those might be for persons that are verbal, and some might be for persons who are nonverbal. And so utilizing all of the different strengths for each individual then becomes very imperative. And what one person's strength is might not be another person's strength. So this is all very individualized for a specific person. Beginning the conversation in a safe and stress-free time and place. Just like any conversation, and particularly with any difficult conversation, choosing the right time is paramount to having a successful and positive conversation. Revisit the conversation as often as needed. As in any difficult decision, sometimes it's best just to sit after a conversation and think about that and then come back to it another time. It could be that you're going to just hear affirmation of thoughts and likes and dislikes that were expressed earlier on, or it could be that that individual has changed their mind on some specific aspect of what they're hoping for. Be sure that all persons within the person's circle of care are both aware and agree to the plan made. So often there are hurt feelings when someone is not within that circle of communication, and a time comes where this plan is then shared with the community and those in the circle of concern of this individual, and maybe one person was not aware that these conversations had taken place. It's very important just to make sure that it's a transparent conversation and that all persons within that individual circle of care are aware of this plan and of the wishes of the individual being considered. And then, of course, most importantly, to honor the plan. It's easy sometimes to think about what might be done, and then yet when it comes to time for it to actually happen, it can be difficult when that time is close and nearby. It's important that we really are able to honor those wishes when the time actually does arrive. I would like to just conclude my thoughts here on adaptive materials for persons with developmental disabilities by sharing a story, if I may. We weren't able to give all of the logistics and parameters around the laws in the state of Maryland, but again, if you have questions, please put them in the questions box. If you would like to speak further about this, we are delighted, Catherine or myself, to talk to you about what resources are available in the state of Maryland. But what I'd like to do now is to tell a story, and this is Charlie's story. Not so very many years ago, a beloved member of one of our community residential programs was very near to his death. Great efforts had been made prior to his illness to have all the conversations about what Charlie's wishes were. He was very clear that he wanted to be at home. And by home, what Charlie meant was in his group home, not in his family's home. He wanted to be in his room, and he wanted people to come and to go freely, to be able to sing with him, to pray with him, just to sit quietly with him. He wanted his friends to have that access. He was also very clear that his favorite little bird buddy would be in the room with him as well. That day did arrive all too soon for those of us who loved Charlie. His wishes were respected and followed through, just as he had outlined. Charlie was never anxious or afraid. He knew just what was happening, and he was very, very peaceful. One of the last things that Charlie said was how happy he was to have Buddy the bird singing to him. Charlie is missed to this very day, and we know that he is at peace and not afraid and surrounded by everything that makes him happy. All this is possible for persons with special needs of all kinds. If you would like additional information, we have attached resources to this webinar. You'll find a PDF of various references attached as a PDF, and that includes also the information for Voice Your Choice in the PDF that is attached here. And you are also always most welcome to contact the Department of Special Needs at any time for more information. We're here certainly to talk with you and to give you whatever resources are going to be helpful to you. Now, Val is going to join us, and Val is going to be talking with us about Voice Your Choice. So Val, hello, Val.
Hi, how are you?
We're doing pretty well here. I'm going to stop sharing my screen, and Val is getting ready to share her screen here. So whenever you're ready, Val, for that, and we'll all then gather again to field any Q&A at the end.
And I'm waiting for the prompt to come through to share.
Alrighty.
Thank you. And are you seeing my presentation now at this moment?
There it is. It just came on.
Okay. All right. Thank you. Thank you so much. I always like to be Charlie's story, Mary. Thank you, Catherine and Mary, for allowing the Voice Your Choice program to join with you to educate the community on the significance of advanced care planning and end-of-life preparation. So again, thank you for allowing us to be here. Today, we will be talking about the Voice Your Choice program and creating an online advanced care plan on the voiceyourchoice.org website. I would like to just briefly go over our program. The Voice Your Choice program really looks to promote advanced care planning through local community training and to bring about public education and awareness, what we are doing today. We actually started out last year doing face-to-face community trainings, but of course with COVID-19, everyone had to pivot to virtual platforms. So that's how we are communicating to the community today. So yes, we have been doing this now for over a year. We also look to motivate people that are 18 years and older to think about, how would I like to be honored, to also think about writing down their healthcare wishes. We know that COVID-19 is affecting all ages, and 18 years old is not too young to prepare an advanced care plan. So we do look to motivate people at least 18 years and older to think about and write down their healthcare wishes. We also encourage people to think about who will speak for me or speak for you if you ever become unable to speak for yourself. And as Catherine pointed out earlier, that would be your healthcare agent. Voice Your Choice program provides a free online planning tool that makes your healthcare wishes more accessible and mobile, and I will be transferring into that platform shortly. The Voice Your Choice program is a program of Nexus Montgomery, led by the Jewish Social Service Agency. So our online advanced care plan is started at the voiceyourchoice.org website. That's the area that you really want to start with. You want to start with the www.voiceyourchoice.org website. You will see on the right-hand side of that website a green button that says complete your advanced care plan. On the left-hand side of our website, you'll see our Voice Your Choice logo, and that will let you know that you are in the right place. Once you click on the green button that says complete your advanced care plan, it will take you to a new user prompt. This is where you want to begin to set up your advanced care plan and your email account. Click on New User, and you will see a screen that states you to set up your account. You want to enter in your first name, your last name, come up with a nifty username, put in your personal email address, your date of birth, and click Submit. And this is beginning to start the email confirmation process. You will find a welcome letter that will cause you to have a required action that needs to take place. If you don't see this email in your inbox, don't forget to look in your spam folder or your junk folder, particularly if this is your first time going to the voiceyourchoice.org website. Once you locate the email, the call for action is for you to click on the lower blue button that says continue. Once you click on that button, it's going to prompt you to create a password. Come up with a nifty password. Don't forget to write down the password so that you will have access to your account. And you will then be confirmed through the email confirmation. You want to now go back to the voiceyourchoice.org website where I showed you earlier and click on the green button that says complete your advanced care plan. But this time when you see the screen that you're seeing now, you want to return back as a returning user. At this point, I'm going to transition to our platform. And I'm hoping that you all are able to see the platform now. You will see, how did you hear about us? You want to enter in your first name, your last name, your email address, and click submit. And you will see the complete your advanced care plan. You will see the complete your advanced care plan button. I'm going to click on that button now.
Val, I apologize. I don't think your screen is sharing. So we're using the website launcher. So you might need to share a different window.
I think it's the tab, Val. Go over to the next tab where it says Voice Your Choice Home.
There you go.
Now?
Yep.
You're seeing it now?
Yes.
Okay. So now, thank you for helping with that and helping me with that. You want to put your first, your last name, your email address. Tell us how you heard about us and click submit. I am going to go into the complete your advanced care plan. And again, this is my test website, so you will see information that's already uploaded into this area. I am returning as a returning user. Here's my nifty username and password, and I'm starting the login process. And now I am on the Voice Your Choice online platform for creating my advanced care plan. Here is the logo here. I immediately go into the My Dashboard area when I'm first logged on, but I want to go really into my decisions, because if I become unable to speak for myself, I definitely want my advanced care, my healthcare agent to be documented. So I click on my healthcare agent. And I'm running just a little slow here. You will see on the right-hand side of every area that you click here under My Decisions, there will be a video. It's about 1 to 2 minutes, and it will help you get a better understanding of the content that's on the page, or to also help you or guide you with a conversation with that person that you are thinking to be your healthcare agent. As you can see, my healthcare agent is Val Walk, and my secondary healthcare agent is Mr. Johnny Test. We always recommend that you at least have 2 healthcare agents, just in case that first healthcare agent is not available if there is an emergency. If you scroll down just a little more, you can see a list of powers that you can give your healthcare agent. And if that is too many powers, you can click on the second button here and just type in your powers that you feel more comfortable with. Another area that we recommend is My Advanced Care Goals. As it was stated earlier, advanced care planning is really personal to you. It's about your faith, your belief, your wishes, your traditions, your culture. So under the My Advanced Care Goals, again, you will see the video to the right-hand side. And the first question it asks you is, what is important to you? This left side corresponds with the right side, this gray area. If I say being free from pain, it will populate over to this particular area as a priority. If I decide that number 1 is no longer really important to me and I exit out, my priorities will go back to 7. And if I exit out again, being with my family, you will see that it will populate back over here. If I change my mind, I can click back on it and it will populate over here. This is a very user-friendly website. You can also, again, put in your faith, your religion, your beliefs. Another area that we also suggest you go into is My Preferences in Certain Circumstances. This is really a medical area. It has a lot of medical terminology. So the Voice Your Choice program disclaimer is that we don't act in the capacity of a medical advisor or a legal attorney. We are just here to educate you on the significance of advanced care planning. But if you do go into this area, or when you go into this area, you have the option of clicking on any underlined words or word to get a better understanding if you don't understand any of the words that are underlined here. So we suggest that you do that. It's also a great location to get a discussion guide, which is about 5 pages. If you are having any type of telehealth appointment or face-to-face appointment with your doctor, you can use this as a guide to direct your conversation with your family members and also with talking to your doctors. It's about 5 pages, so it's a good alternative for you to help keep you on course with your discussion with your doctors. Another area is under My Decisions, My Dashboard. If you have a 5 wishes that was stated earlier that you would like to upload, you can see where I have uploaded a 5 wishes test sample. You would go into this beautiful blue area on the right-hand side and click Document Upload. And I apologize, I'm running slow today with this computer, not sure what's going on. I'm going to show you how I actually uploaded a 5 wishes document. It's getting there. And so I actually took a paper 5-wish document. I filled it out. I scanned it into my computer, and I used the Voice Your Choice website document upload to actually upload a paper document. So now my family doesn't have to worry about keeping up with a paper document. It is now in electronic format that my doctor will have access to. I do want to point out, whenever you do add a document, give it a name. Try to match the type of document you have with this list that's provided to you. Also, when you create the document, keep in mind that your doctor will always go by the most recent document and the most recent creation date. So if you're uploading a lot of documents, just remember that the doctor is going to be using the most recent date. I'm going to now transition back to the PowerPoint presentation, and hopefully it will come through fine for us. Did this come back through?
Not yet, Val. You're not sharing your screen.
Okay, I am pointing. Are you seeing it now? No?
We are seeing the launcher tab to go to webinar, not the PowerPoint.
I am trying to get it to you. Well, I can just go over the last two slides. It's really a verification. The next slide was really a verification slide. When you go through the voiceyourchoice.org website and you're ready to sign your documents, it will ask you to go through a verification process. And we like to talk about the verification process because it asks for your social security number and also your driver's license. And sometimes people don't necessarily feel comfortable with putting in both of those types of identification. We want you to keep in mind that it is an extra layer that's provided to your providers to make sure that you are the patient that he is matching with your electronic medical record and your advanced care plan that you bill online. The Voice Your Choice program never sells any type of personal information. The only people who have access to your information is those who are the people that you have assigned as far as your healthcare agent, or if you've given anyone your username and password, they have the ability to go into your voiceyourchoice.org website. But other than that, the doctors are the only ones who have access to your advanced care plan online. And then my next slide was just my information where they can contact you, Mary or Catherine, to get in contact with me. My email address is vwalker@jessa.org. Again, vwalker@jessa.org. When they visit the www.voiceyourchoice.org website, we have many available resources under the community tab. We do have upcoming webinars that I present going very much in detail about advanced care planning. We also have upcoming webinars that we present to our providers and medical community. We upload those dates monthly, So in another week, you will see our November dates. We ask anyone to go to the voiceyourchoice.org website and register for any of those webinars that are coming up. The registration is free, the training, the webinars are free. I normally do about 7 per month, and then the provider ones are about 4 per month. We provide them anytime during the day and the evening time. So again, you can reach us at the voiceyourchoice.org website, or you can reach me, bwalker@jessa.org. Thank you.
Thank you, Val.
Sure.
And Catherine's back on. And Val, are you joining us here? That's wonderful. Yay.
Sorry about that.
All together again. No worries. All together again. We have about 10 minutes left, Val. Thank you so much for walking us through all of the information that's pertinent to Voice Your Choice and explaining to us how to access the information and how to utilize it. Thank you so very much for that. We have had a couple questions come through. So, Val, I think this first one might be to you.
Okay.
For this, the question is, for this online tool, how could a hospital know that you had completed this? For example, if you were taken by ambulance and the family was not with you.
And so with it being an online platform, in the background or in the back area of the website, it is connecting to a third-party vendor that is called CRISP. And doctors pretty much in the United States have, for the state of Maryland, it's called CRISP. But every doctor has a database that he has the ability to link into when he is going into the medical record. And so that attaches to the Voice Your Choice online platform. And a doctor can see your advanced care plan through CRISP. And they're connected together. So they have access and you don't have to worry about carrying in anything as long as you do it online. It is available to the medical hospital 24 hours after you create your account online.
Thank you. Thank you for that.
Sure.
We have a second question here, which Catherine, I think we're gonna punt to you for this one. Does the Catholic Church offer guidance on stopping a treatment? For example, if the person believed a treatment for using oxygen was burdensome and wanted to stop a routine treatment?
The simple answer is yes, the Catholic Church does have some guidance on this. So of course, it's always morally permissible to stop a treatment that is unduly burdensome or is harmful to the patient in some way or another. So if a process is causing someone pain or is causing someone an extreme burden, then it is morally permissible to stop this treatment. But it's never morally permissible to stop providing someone with their basic needs. So to stop providing someone with food or with water or with basic hygiene practices would not be acceptable. But kind of what the teaching really gets at, and it's all based in that virtue of prudence, is just understanding that if a process or a treatment is burdensome somehow or painful to the patient, it might be morally permissible to stop that treatment. Again, that also does fall into kind of difficult questions around a person's age, their well-being, and whether or not this is a routine treatment. So I know this question specifically gets at stopping a routine treatment. So if the treatment is intended and is likely to cure an illness or to help someone, especially in a very basic way, we'd encourage that person to continue that treatment. However, if a person was at the end of their life and they were suffering and the treatment was causing them pain, that might be a completely different situation. So again, it's all about that virtue of prudence. It's all about striking that balance. And it's all about kind of processing all of this through discernment and by looking directly at the circumstances.
Which is yet another beautiful example and rationale for having these conversations, correct?
Yeah.
Because these aren't simple questions. and they don't have simple answers. So having these conversations with your family early on and making sure that your needs and wants are known, how vital and important is that.
Yeah, I agree with you, Mary. I think a lot of times we think we are prepared, like in my mother's situation, and then when we find that things start changing towards the end, there's a big, we wind out, we realize there's a big pool of gray area that we really didn't even see or think about. So nothing is really black and white. So the more you can have the conversation and normalize it, the better prepared you would be, you and your family, you know, when that time comes. So I agree with you. It's a big gray area out there.
Yeah. Yeah. We had one additional question, Val, and I'm kind of, oh wait, oh no, we have some more. So, but Val, this one is going to.
I'm going to stay with you.
Thank you, because I don't know the answer to this question. The question, Val, to you would be, are these documents that are uploaded, are they legally binding?
Well, like I said, we are not providing any type of legal advice. I think if you upload a document, it's really for the purpose of making it an electronic format. If you want to know if it's legally binding, you may want to talk to an attorney to make sure that it's legally binding before you even upload it. And then that legality would transition to the online platform. And so that's the only way that I'm going to be able to explain that. You know, I believe uploading it to the website doesn't change the legality of it at all. But I would, you know, if that's a concern, I would talk to a doctor about it. If it depends on actually what type of documents they're talking about. Are they talking about a MOS? Are they talking about the 5 wishes? You know, we know with advanced care planning, an attorney is not really needed. And I'm hoping that I haven't stepped on any attorney tweets on this website. But, you know, they're not really needed because advanced care planning is personal to you. And so it doesn't have to be a legal document. So I hope I answered that question in some way.
Yes, thank you, Val. Thank you for that.
Sure.
We had an interesting question from a self-advocate. And the question reads, I am a person with a developmental disability who has a parent who has a cognitive decline. Are there any resources or contacts or supports? So the answer would be yes, but as we were talking about earlier, every situation is unique. And so there's not one answer that would kind of cover such a question. It would really be accompanying someone through making those very personal decisions that are very specific and unique to that family situation. So I did send back a little note and promise that we would catch up with that individual later and have a conversation. But that is a perfect reason for revisiting these decisions and plans because things do change.
Yes.
So I'm thankful for the question. I'm very thankful that we have a self-advocate, a person with a developmental disability attending our webinar today to give that voice and that perspective. And this is a wonderful way that we can recognize that just because a plan is set doesn't mean that it's always going to be in stone, that oftentimes it's going to have to be adjusted for life changes and things that happen as well. This question, I think, could go to either one of you or possibly both of you, so whoever chimes in. If a doctor determined that there was no hope, but a family felt care should continue, what is the right decision? So not to fight about it. Val, do you want to answer first and we'll punt to Catherine?
I'm taking a deep breath. The right decision is what feels good for you and what feels good for the family. You know, no one wants to let go a family member because it's a loss. But at the same time, if their quality of care, like Catherine pointed out earlier, is not going to return to a positive quality of care where you can have that type of relationship with them that you have continued to have and want to continue to have. Prolonging that prolongs suffering. And so, you know, if the doctor is recommending discontinuing the care and just saying, let's keep the patient comfortable, for me, what's right for me would be I would have to decide I don't want that particular family member to continue to suffer if the relationship is not going to change. Now, again, the same thing. If my family member is going to be able to communicate with me, we're going to be able to have a conversation, get that person back home, spend some time together, then I would fight against the doctor and say, you know, no, I want to do this. But you have to make that own determination for your own self. So it's really a personal question. If there's not a right or wrong answer, because Catherine is going to come with a different type of response. And so you have to find it in your own perspective, what works for you and your family.
Absolutely. And I would just build on Val's response there, that it really is an individual decision. And this is why advanced care planning should happen and should happen sooner rather than later. Because the individual who's directly impacted by an illness should be the person who initially gets to make some of these decisions about their own well-being. And I know in my own family, I've dealt with this issue with close family members and relatives, and we've actually dealt with it in kind of multiple aspects. So we had a situation where a family member decided not to continue care because the doctor was suggesting that it wouldn't do much to help. We also had a situation where a doctor was saying that care was no longer necessary and that this relative would eventually be fine. And in the end, that relative ended up passing away. So I would say that we do acknowledge that at times diagnoses can be wrong, at times doctors can be wrong, but it's also really the decision of the person who's directly impacted by that illness. And if that person decides that the care that's being given to them is hurting them in some way, or is causing them burden or causing them any type of harm, then that person has the right to make their decision regarding continued care and treatment. Once again, we really do establish that this care and treatment should be ceased if it's burdensome, if it's a generally harmless treatment or a treatment that has the potential of really helping the person, then absolutely they should continue that care. But if the treatment is not doing anything to benefit them and is only hurting them, then I think it's clear that that person can make a decision in their best interest, again, with the guidance of their faith tradition and the guidance of the morality of the Catholic Church.
We've just gone past our time, but we have one last question. I just want to honor the participant who has asked the question here. So maybe if we could just take a minute to answer this very complicated question. And before we do that, I would just like to share with everyone that at the close of this webinar, a very brief 3-question survey will launch. We do ask if you would kindly take the time to answer the very brief 3-question survey. The answers will be then shared with Val and her staff at Voice Your Choice. So if you would be so kind, please, as to take a few minutes right after just to answer a 3-question survey, that would be wonderful. Our concluding question, Catherine, you can begin the answer, and then maybe I'll chime in with a few thoughts as well here. It's not an easy one to answer. During COVID, there have been reports of people living with disabilities and elderly persons being denied treatment because a doctor determined that they do not have a quality of life now. How can we advocate for equal care?
I think everyone on this call would agree that the dignity of the human person is the most significant thing that we have in our lives, and one of the things that we really fight to protect at all stages. So especially when people are being denied care, and especially when the vulnerable are being denied care, we have a duty as citizens, and we have a duty as Christians and as Catholics to really fight for that person and to stand up for them. So we do have some advocacy opportunities, again, through the Maryland Catholic Conference and through the Archdiocese of Washington, if you are interested in getting involved. But of course, advocating for equal care takes a lot of different forms. It means advocating for healthcare. It means advocating for fair treatment in the workplace. It means advocating for COVID preventative measures and vaccines and mask wearing. So I think this takes a lot of different forms. I think this is a great question, though, because it really gets at our duty and obligation to protect the dignity of each human person, especially the vulnerable, so especially people with disabilities, and especially the elderly, and especially the unborn.
So thank you, Catherine, for that. And I would just want to add, as we're talking about the different legislation that will be coming in our next legislative session, that there again is a wonderful opportunity if you would like to get involved. The Maryland Catholic Conference will be having information coming out very soon on what their legislative platform is. If you would like to be engaged in any way with protecting and advocating for the dignity of all human life, that is a wonderful place to start. There are also, for persons with disabilities, the ARC of Maryland will also have a lot of information coming out with COVID-related legislation to protect those that may be being denied access to medical care. It is of great concern, of course, to all of us right now for that. So we've come to the end of our questions. Thank you to our participants for these absolutely phenomenal questions.
Yes.
And Val, do you have any concluding comments before we sign off for the afternoon?
Well, I just want to thank you all again for allowing Voice Your Choice to be a part of this program today. It was wonderful. I would again reinstate, if our participants will take the time to fill out the survey. It's an evaluation. We really take those evaluations seriously. It is anonymous, so we don't know who's saying what, but we do go back and review those responses and adapt our training program based on the feedback that we get, and also to visit the voiceyourchoice.org website for our magnificent resources that we have available, and I hope to see someone register for some of the webinars that we have on site. So once again, thank you, Catherine and Mary, for inviting us in.
Absolutely.
Catherine? And thank you so much, Val, for joining us here today. And thank you for all the resources that you've provided. I hope that everyone will take advantage of these resources and contact any of us with any relevant questions.
Yes.
And once again, please, there are some PDFs attached in your handout sections of the control panel. And as a last reminder, as soon as this concludes, a survey will be sent immediately. If you would please be so kind to answer the quick 3-question survey, that would be of great assistance to us. Thank you all for your participation today. We're happy to spend this hour with you, and we look forward to meeting again at a later date. Thank you, everyone.
Bye.
Bye. Bye.